Well, good afternoon, everybody. This is the, as you all know, this is the Breaking Good briefing. It's about how local communities are making progress in the fight against meth. My name is Malcolm Spicer. I'm in the media, and I write about, among other things, formulations for pharmaceutical products. So I've written quite a bit about Acura's Pharmaceuticals work in tamper-resistant pseudoephedrine products. So I was asked to moderate this panel today, and I'm certainly glad to be here and glad you all are here too. On the panel we have today, right here to my right, is Courtney Hunter with the Partnership for a Drug-Free America. She is the Director of Advocacy and External Affairs, and next to her is Jim Langford of the Georgia Meth Project. He's the Executive Director for that project, and he's been for over 35 years, he's been quite involved in Georgia commissions and boards, natural resources, environmental advisory, and other humanities council and other things. And then next to Jim is Lori Phillips Jones. She is the former 8th Judicial District Attorney General in Tennessee, and where she worked for 2 years as the Attorney General, and she previously worked more than 11 years as the Assistant District Attorney in the state, and currently she's a member of the United Cumberland Bank Board. And next to Lori is Lynn Fruth, who's president of Fruth Pharmacy. It's a chain primarily in West Virginia, but also with some stores in surrounding states. And she's been the president there since 2010, and she also works as a private consultant to county school systems in the state to help establish innovative programs for schools. So thank all of them for being here today. My bio was much less impressive, so I won't even bother with it. So, and we have the great pleasure and honor of Senator Manchin joining us right now to deliver some opening remarks.
That's always a good sign here. If they'll feed you, you're in good shape. Let me just say that, first of all, I'd like to thank all of you for coming here today to highlight the successes that we've had in West Virginia. I want to share them with you in combating the meth abuse, and I'd particularly like to thank my dear friend Lynn Fruth, because really, truly, it was her courageous leadership that got us going in the right direction. She's the one driving, she's the force behind it, an effort to promote corporate responsibility and to get single ingredient pseudoephedrine products off the shelf in state of West Virginia, my state. The simple truth is that while single ingredient pseudoephedrine products are legal, they are endangering the citizens of not only West Virginia but this entire country by fueling the domestic production of meth. Over the past year, I've made it one of my top priorities to proactively address the problem by working with pharmacies in West Virginia to get them to offer only multi-ingredient and tamper-resistant pseudoephedrine products in their stores. These medicines provide cold and allergy relief, but are much harder to convert into meth. In addition to Fruth Pharmacy, who took the lead on this, we also had CVS, Walgreens, Kmart, and Rite Aid. They've all taken that important step in their stores in West Virginia to remove single source from the shelves. These companies have demonstrated that they want to be good corporate neighbors by implementing these policies. I've also tried to work with the West Virginia State Legislature, who has not had the courage to fight the lobbyists to do the right thing. So we were able to do it directly by Lynn taking the lead, getting corporate responsibility to do the right thing, and did not hurt their business. I'm still urging them to adopt policies that will make it harder for meth cooks to purchase single ingredient pseudoephedrine products in bulk. While we have many strong advocates in our state, we will have a lot more work to do to get them to adopt the policies needed to save lives. The small steps that West Virginia has taken have made big differences. In 2013, meth lab seizures in West Virginia spiked to 533. That was an 86% increase over 2012. In 2014, after these pharmacies took single ingredient pseudoephedrine products from their shelves, we saw a 40% drop. A 40% drop in the number of meth labs. While I'm encouraged that the number of meth lab seizures has been significantly reduced, there is more work to be done. Too many West Virginians struggle with addiction, and we need to continue to take strong action to stop the cycle of abuse. I have fought in my state to address meth abuse from every angle I can, reducing access to the products that are used to make meth, taking down meth labs, and improving treatment for addicts. However, this is a national problem that requires a national response. I hope that other members of Congress will take the similar actions in their states also. And I hope that all of you as on the staffs and working in these offices will take these successes that we've had back to them. While it is not simple, it is incredibly important. Convincing these pharmacies to be responsible corporate neighbors have saved lives in West Virginia. And I can't tell you how receptive they would be. You'd be surprised. And they were very pleased to be able to help. They knew we had a problem and they stepped forward. I hope we can seize this opportunity to work together in a constructive and collaborative way. Let me say that, first of all, prescription drug abuse is the #1 killer in the state of West Virginia. Kills more people than anything else in my state. And anytime you have a state that's been hit hard economically and people have very little hope, this is what they rely on. This is what their fallback position is. And there's not one of you sitting in this room, not one of you, that doesn't know someone in your immediate family, your extended family, or a close friend has not been affected by drug abuse. It is of epidemic proportion. We all know somebody. And it doesn't have any barriers. It's not partisan. It is truly nonpartisan. Whether you're Democrat, Republican, conservative, liberal, whatever you consider yourself to be, it can strike and strike hard and has devastating effects. And I've said this, and I will say this to all of you. I get to travel around the world, and I see an awful lot of what's going on. I talk to a lot of leaders, and we have a troubled world and a divided country. And it's very dangerous right now what we're dealing with. So as I go around and I talk to leaders of different countries, there's not one country in the world that believes that they can take on this government, this country, United States of America. They can take us on militarily, or that they can take us on economically. They don't believe they can do it, and they're correct, they can't. But they don't believe they have to. They're going to wait and sit back and watch us destroy from within. They don't think that the young generation here, that your generation, will be able to compete at the level that you will need to compete to be a global power, superpower. They don't believe that you'll be educated well enough, have the skill sets, or be clean enough. It's truly what they believe. And they're just sitting back waiting. And statistics pretty much shows them a pathway of success. So it's up to all of you. You know, I feel ashamed that my generation is turning over a country in worse shape than I got it from my parents. And I'm fighting like the Dickens to make sure that doesn't happen. You all really need to step to the plate and fight this. And basically, how can you explain 5% of the population of the world is in the United States of America? Only 5%. If you're taking 5% of the population that's responsible for consuming 80% of opiates on the market today, tell me how that makes sense. How did we get to that point in our life? I grew up at a time we never heard about this stuff. It wasn't mass produced. It wasn't shoved on us. If you were in severe pain, you were in a hospital, you got some morphine, and then you left, you were done. You were back on your own. Bear aspirin, let it rip. You know, and that was it. If you weren't tough enough, then shame on you. But not anymore. Since about the 80s, my God, if you got a toothache, we'll give you 30 Oxycontin. Makes no sense at all. And the doctors have no idea how to prescribe it because they haven't been trained for it. We got pharmaceutical companies that are producing drugs and more potent than what they had before when their exclusivity runs out in 12 years. It's exactly what their business models. We have the FDA approving stuff should never be approved. And then we have doctors dispensing it, don't know how to dispense it. And I'm just committed. I've committed my tenure in the Senate to do everything I can to fight this. And I appreciate all of you all coming and showing an interest. I just hope you take up the cause because it's something that you should do. By the grace of God, it could be you, could be a very close family member, could be a sibling, could be a cousin, could be your parents, could be anybody. And if you go down in some of the coal fields I go in and you watch kids come to you crying and begging us to do something, a 13-year-old girl coming to you and says, my family's been ruined. My daddy worked in the coal mine. He had a back industry. He got addicted. And from that, we've lost everything. Families fallen apart. They've lost their home. They've lost everything. And this is repeated over and over again. And it was just uncalled for. So, Lynn, I thank you because you have been. And Lynn's, I can't say enough. You know, I knew her father. I knew the family. I know their commitment to West Virginia. But also a responsibility they have to do the right thing. And she did it. And very few people have the courage to do what Lynn did. Lynn says, I'm not going to sell single source anymore. Don't care what it does to my business model, not going to do it. Thank you all.
Thank you, Senator. And I'm sure you'll agree he certainly surmised and summarized what the situation is and the problem is. But if I could set a broader platform for this, what the current federal legislation, the federal law, is commonly referred to as the Combat Meth Act, or the Combat Methamphetamine Epidemic Act, actually. And because of that, a lot of good has happened, and then some states and local governments also have enacted their own tighter, somewhat, regulations on top of that. But this is a case of, for every action, there's an equal and opposite reaction, and that was, unfortunately, the importation of methamphetamine from Mexico, and perhaps is made in other areas, but it comes in through Mexico. And so, whereas today there's been a lot of progress, as the senator said, in stopping or slowing illicit methamphetamine production, there is more coming in from Mexico. And so that's where we are today. So first of all, we're going to have each of our panel members, who each have a unique experience in this area, talk about the work they're doing and that their groups are doing, and how it's making a difference in communities as far as stopping the diversion of pseudoephedrine for the production of methamphetamine. And we'll start with Courtney, please.
Hi, everyone. My name is Courtney Hunter. I'm the Director of Advocacy for Partnership for Drug-Free Kids. We used to be Partnership for Drug-Free America, so that's some of the confusion. In 2013, we acquired the Meth Project from the Siebel Foundation out of Northern California. It is the largest and actually the only national prevention campaign that focuses on crystal meth. We run PSAs, so a big messaging campaign, a website called methproject.org, and also community outreach. We do extensive community outreach. And sitting right next to me is the executive director of one of our most successful state programs, Georgia Meth Project.
That's me. You want me to go? I'm Jim Langford. I'm the executive director of the Georgia Meth Project and work with Courtney on a regular basis. We got started in Georgia in 2008 and 2009, incorporated our organization in 2009. It's a nonprofit, 501c3. We get almost all of our money from private sources. We got a tiny bit of money that was an earmark back when people were able to get those. In 2009, Senator Johnny Isakson helped us tremendously from Georgia. He is still a good friend and still helps us quite a bit. I don't know if any of his staff people are here today. There's somebody back there. Great, glad you're here. And so he's been a big help to us. But we get no state funding. The state of Georgia only spends $230,000 a year in drug prevention of any kind of their own of state funds. They do have a little bit of federal money. They do some pass-throughs on that, and we've started to get a tiny bit of that for a couple of programs. But we had to go out and raise, in our first year, about $7 million before we could launch anything. And then when we finally launched, we launched the massive media campaign like they did in Montana, Idaho, Wyoming, some of those states, and we did that in 2010. What we were doing there was 588 billboards, 26,000 radio ads, 23,000 TV ads, all in prime time, not late night PSAs when nobody's watching, all prime time advertising. Focused on a couple of demographics. One, 12 to 17-year-olds. That was our number one demographic. Second demographic, 18 to 24-year-olds. Before we ever started the campaign, the first thing we did was spend a lot of money on surveys. Paid some very big dollars to the Roper Agency out of New York, because they had also done similar surveys in the other meth project states. A couple of key statistics that we were looking at. One is perception of risk. And what we saw was that before we ran the first ad, 35% of the young people in Georgia thought there was little or no risk in trying methamphetamine, 35%. 23% actually thought there was some benefit to trying meth. help me lose weight, help me study better, help me with boredom. I mean, crazy things, you know, that probably some 14-year-old was told by some 18-year-old somewhere. It just didn't make any sense at all. So we knew we had a big problem. We knew we had an urgency. We spent a lot of time with sheriffs, a lot of folks in law enforcement. We talked to every sheriff in Georgia. There are 159 counties in Georgia. We talked to all those guys, and what we found out was that meth was their number one problem, the number one thing that they, one sheriff said, I wake up in the morning thinking about meth, I go to bed at night, that's the last thing I'm dealing with. It's all day long, every day. And so lots of other statistics that we may come back to in the later part of the discussion. But in 2011, we then moved to an online piece of the way we approached education programs in Georgia. So we launched a meth prevention lesson. In that meth prevention lesson, it's downloadable. Teachers are able to see it, look at it. We're able to see exactly which teachers have downloaded it, how many kids are in the room, which schools, those kinds of things, and we can track that on a daily basis. We've trained several hundred teachers in Georgia to teach that program, and we're continuing to do that. We then in 2014, early part of 2014, we changed our name and expanded our focus from the Georgia Meth Project to the Georgia Prevention Project. So because law enforcement and schools and lots of other folks were asking us to go ahead and expand what we're doing into prescription drugs. As Senator Manchin said, you know, that's the other big thing that's happening now. There are more deaths in Georgia now from drug overdoses than there are from car accidents. That's every week, every year, that's what's happening. So that curve has just been accelerating in Georgia. Now, percentage of those related to methamphetamine, you know, we can talk about that. We think that has leveled out or gone down. We've had a significant decrease in the number of meth labs in Georgia. That has gone way down. Now, that's the good news. The bad news is that 98% of the meth now in Georgia is coming from Mexico, big cartels. Cheaper, lower price, I mean, it's in higher quality than ever before. And Atlanta has become the East Coast distribution hub for meth like Miami was for cocaine back in the 1980s. So that's a big deal, and we'll, again, come back to that as a discussion detail. But the point is, our fight against meth is continuing. We are continuing to do more programs every year out there. We think we've made a big dent in it. We know that 35% that we talked about, 35% of kids who thought there was little or no risk in trying meth, we've got that down to 11% now. So we know we've driven that down with this program. We've got a lot of online advertising now. Instead of heavy media on TV, radio, billboards, it's now online, very specific in its demographics, highly targeted, a lot cheaper to get that advertising, and that's being very effective as well. Maybe we'll come back to some other statistics as we have time. Thank you.
Thank you, Jim. Lori?
Hi, I'm Lori Phillips-Jones, and I served for 2 years as the District Attorney General for the 8th Judicial District. And I'm here to give you a very local, rural perspective on how you can take a message back to your communities to fight the meth problem. When I became DA, Tennessee was second in the nation for meth lab production. And one of my counties, which is a very small rural county, was in the top 5 of the state for meth labs. So meth labs have so many impacts on your communities. Not only are kids in school impacted by being in homes when there's meth labs there, you also have people who rent to folks who make meth, and the cleanup for that is unbelievably expensive when you have a meth lab. We were also having meth labs in hotels and motels, and the number of children going into state custody because of being in a meth lab home was astronomical. So what we did with a local anti-drug coalition is called in our local pharmacists and spoke to them and had a dialogue with them, because the bottom line is you can't make meth without pseudoephedrine. So our message to them was, wouldn't you like to make it harder for these folks? Wouldn't you like to make it impossible for them to make meth? So there was a new drug on the market called Sudafed, and we told them that it has meth-impeding technology, which makes it extremely difficult to extract the pure pseudoephedrine. And we asked them, as their first line of sale, to sell Sudafed instead of Sudafed. They agreed, because there are all kinds of problems associated with people coming into the pharmacies to try to buy Sudafed. There's lots of shoplifting, a lot of crime occurring outside of the pharmacies. They agreed, and within 6 months of our conversation, in one of our communities, we had a 90% drop in meth labs. Basically, if they couldn't get the Sudafed, they were going to go elsewhere to make their drugs. And so I'm here to show you a very simple solution to a very expensive and life-altering problem. There are drugs out there that are available that make it hard to make meth with, and we should be encouraging our communities to use those drugs instead of making it easy for these meth makers to run up a huge price tag for us taxpayers. Thank you.
Thank you, Lori. Lynn?
I'm Lynn Fruth, and we had the distinction of being the first chain in the country to make a decision to completely remove single ingredient Sudafed from our stores. We were made aware of the product Nexafed in 2013, and actually my lead pharmacy guy in the chain came and talked to me and said, you know, Lynn, I think that we can bring this into West Virginia, and we have the chance of really leading the way. And we discussed that. My CFO immediately wanted to know what the financial impact could potentially be. And frankly, after a long discussion as a CEO, I said, you know what, we're going to do it. And we might lose some business, and financially we might have some reduction in sales, but it's the right thing to do. And so we held a press conference in August of 2013 and announced that we would be removing all single ingredient Sudafed products from our stores. We actually went into our pharmacy system and blocked it so that the pharmacists couldn't even order it if they wanted to. And we replaced it with the tamper-resistant Nexafed. I'll tell you, when I went to we had a press conference, I thought, you know, a couple papers might show up. We actually had every news agency in the state there, and it was the headline news on all 3 channels at 6 o'clock and 11, as well as all the newspapers. So it was huge news in West Virginia, which has a huge Sudafed problem. One of the things that I spoke about was that we wanted to try to bridge the gap between figuring out a way that we could continue to offer access for legitimate customers who felt that Sudafed was an effective product for them without having the product make its way into the illicit channels. And I was also aware of the extreme financial burden that going to an RX-only model would do to a state and to insurance. In West Virginia, we estimated that the cost to Medicaid, if Sudafed went RX only, would be somewhere in the range of $1 million a year. Because now patients wanting that prescription would have to go to have an office visit, there'd be a copay, and the cost of the drug would go up as well. So to us, it seemed like such an easy, no-brainer solution to say, let's bring in a tamper-resistant product. I think that what happened next really shocked me. I was prepared for a little bit of backlash from people complaining, and I got practically zero with that. Over the next month, every place I went in the different communities where we do businesses, people stopped me on the street, at church, in the grocery store, at the movie theater. Thank you so much for taking Sudafed out of your stores. What I learned from that was the consumers wanted to be a part of the solution. They were willing to pay a slightly higher price for the product in order to feel like they were making a conscious decision to be a part of the solution and to not continue to support the makers of the single ingredient products that were finding their way into meth labs. The other thing that happened was I started getting emails and letters from people across the country telling me about, I lost my husband to meth addiction. But the most poignant one actually came from a business partner who I had done business with for many years. Our technology provider sent me a private email, said, I want to thank you for taking meth out of your stores. You know, my son right now is in the fight of his life with this disease, and I appreciate the fact that you're putting his welfare ahead of profits. And so what opened my eyes then was that there's a sort of a perception that meth addiction is a backwoods kind of thing that only impacts Appalachia and uneducated. And what I found out from the people who responded was that it really cut across all socioeconomic factors, and that it was impacting many, many people, educated people, their children, grandchildren. So people just immediately embraced it. Our pharmacists supported it 100%. The kind of stories that they related to me was, as a female, they'd say, I'm a female pharmacist, I'm working the night shift, it's 15 minutes until 9, we're getting ready to close, 6 scroungy looking guys come in and want to buy Sudafed. There's only a few people in the store, I feel sort of threatened. So some of the people talked about the fear factor of having the product in the store. With Nexafed, it's very easy. You offer the sale, and if they're interested in making meth, most of the time they say, no thanks, that's not what we're looking for. So our pharmacists embraced it, our customers were overwhelmed by it. And what we'd learned was, even though the tracking system known as NPLEX, which tracks, you take the driver's license of people purchasing Sudafed, that it really had not proven to be effective in impacting the number of meth labs, primarily because of an activity that's known as smurfing, whereby, I get my carload of friends and I say, I'll give you guys $5 a piece if you go in Fruth Pharmacy and buy a Sudafed. And so if you would sell a box of Sudafed, then 3 or 4 people would come in immediately after that seeking the drug. So the Nexafed completely did away with that because they didn't want that product. We did see about a 10% reduction in our chain-wide. We took it out of all of our stores, not just in West Virginia, but all of our stores. West Virginia, Ohio, and Kentucky do not carry single-ingredient Sudafed. I have had a fair amount of pressure from the Consumer Health Division of certain companies to bring their product back. And I told them that, you know what, when it's your store, you get to do what you want, and I'm choosing not to sell your product. The decrease in sales told me that about 10% of what we had previously been selling had probably been making its way into the illicit channels, which wasn't much because we frankly had done a very good job of policing our own sale of Sudafed. We then went out to, I really used the media, and I would encourage you in your states to really utilize the local media to push the initiative. We were very fortunate in the Capitol that the Charleston Gazette, and particularly one reporter, Eric Eyre, took this up as a cause, and they started routinely publishing in the paper the stores in West Virginia that were selling the most single-ingredient Sudafed. It was kind of like the shame list. And so after a few months of that, I got a call from one of my friends at Rite Aid. And the VP at Rite Aid, Robert Thompson, asked if we could have some discussion about what was happening in West Virginia. And I said, Robert, you're getting killed in the media over here because a lot of your stores are selling a lot of Sudafed. And he recognized that and wanted to say, they wanted off the list, frankly. So there was a little bit of peer pressure there. I talked to him about how the pharmacists felt, about how the consumers felt about it. I said, it's a win all the way around. You're going to now be the guy wearing the white hat. Everybody thinks you're a great guy because you're stopping the problem. They agreed and took Sudafed out a few months after we did. And then from there, Joe Manchin picked it up, and he just kind of started dogging people to death, frankly. He called the CEOs repeatedly. I'm on a few boards with some of those gentlemen, so I had an opportunity to talk to the CEO of Walgreens and Rite Aid and other companies and encourage them. Walmart, I'm still on Walmart's back too, because I say, take it out, join the fight and take it out. So we saw that Kmart, Walgreens, and CVS joined us, but only in West Virginia. So if you're in a bordering state, you can still go into Ohio in a lot of those stores. So it was like they said, okay, Senator Manchin, we'll do it for you in West Virginia, but they haven't taken it out chain-wide. So the next step that we really need to get to is having other states. I need the legislators in Kentucky to start to pressure those same chains to say, hey, you took it out in West Virginia, we want you to take it out in Ohio. We want you to take it out in Kentucky and Indiana and other bordering states. Law enforcement has reported to me that they have not yet busted any meth labs where they found the tamper-resistant product Nexafed in the cooking process. So that tells me that the product has deterred that type of production. A representative from Acura actually came and did a demonstration for law enforcement and showed them how the product worked, and the law enforcement there was very impressed. It's important that single ingredient products have to be removed. Some of the chains are going and saying, well, we'll bring in a tamper-resistant product. But if all you do is bring in a tamper-resistant product as an alternative, you're still not addressing the meth problem. The single ingredient product has to be removed, so that's the only option. Our pharmacists were trained to actually tell people how they could get the effect of, say, a combination product by using Nexafed in combination with a Tylenol product, or Nexafed in combination with an Advil product, to get to certain combination products where they wouldn't have to have any type of straight Sudafed at all. I want to thank Senator Manchin for being very courageous and taking up the fight and really just shamelessly going after the pharmacies to try to get them on board. Over 60% of the Sudafed that's being sold in West Virginia right now is a tamper-resistant form. That's largely being driven by the chains that I mentioned, Fruth Pharmacy, and a lot of our independent pharmacies. But the work that we have is not complete, because we can still go across the river and 30 miles into Ohio, you can still buy single ingredient Sudafed. When I met a few weeks ago with Congressman Bill Johnson and a group of pharmacists from Ohio, every single pharmacist from every chain that I've just mentioned, Kmart, Kroger, CVS, Walgreens, Rite Aid, Walmart, all said, I would like our company to take single ingredient Sudafed out of our stores as well. So the pharmacists support it. It's about getting enough leverage to try to get the executive level at these major chains to do the same thing for your state that they did in West Virginia.
But Lori, this certainly dovetails with much of what Lynn was talking about. In addition to encouraging stores in various communities to use the tamper-resistant formulations, are there other things that Tennessee is doing in the way of local regs or perhaps statewide regs?
Tennessee did decrease the amount of Sudafed that can be purchased in time frames in 2014, and a lot of the local drug coalitions are trying to educate more folks and get the word out there about how pharmacies, local communities can help fight the meth problem. At one point, I was definitely on the prescription-only bus. I was determined that it needed to be prescription only, but I've changed my mind over time, because our pharmacists are sort of our first line of defense. And if you can educate them as to the other products like Nexafed that are out there, and educate them in ways to divert people from buying Sudafed who really show no physical signs of congestion, and drive up in a pickup truck with 20 people in the back of it who are all going to consecutively come in and buy Sudafed, I think that's your best route to go. I don't think that the consumers necessarily want it to be prescription only. So I think education and reaching out to those pharmacies and working with them is the best way to go.
Let me follow up on that, though. Certainly some consumers, and it's encouraging to know what the response Lynn described has been from the customers of her stores, but some consumers are going to ask for certain brands. So, and that is lowering the monthly or daily purchase limits beyond what's in the federal act. Is that a possible other alternative?
Yes, states could certainly do that. And I almost think Tennessee did it because first Kentucky did it. So everybody in Kentucky was coming to Tennessee because our limits were higher. And so it's a very real way that states can limit the amount of pseudoephedrine products that can be bought.
Okay.
But it doesn't stop the Smurfers. I mean, I can bring 20 of my friends in to each buy a box, and so you're defeating the limits by bringing other individuals in to buy it. So the limits, it's not the best solution.
Jim, in Georgia, are there other things besides the tamper-resistant formulations that help?
Well, not particularly. And again, we've just seen this heavy trend in Georgia away from the labs. Now, part of that has been because of the laws that have been passed with regard to making manufacturing so severe in terms of the penalties for manufacturing are now so severe in Georgia. Even just getting the precursor materials together, if you're caught with more than 2 of those ingredient kind of materials, other things, then you can be incarcerated for and convicted on manufacturing charges. And so that has led to a huge increase again in the use of methamphetamine coming from Mexican sources. So the manufacture of meth in Georgia has just plummeted. I mean, I was with the DEA last week in Georgia, and they're telling me, I said, I've been quoting 80% of the meth in Georgia being consumed is now coming from Mexico. They said much higher, like 98% or 99%. We just don't see any meth being manufactured in Georgia. If it is, it's in very small, 1 liter bottles, where you're making the one pot method. But even then, it's very difficult because of, yes, there've been some behind the counter things, other legislation like that in Georgia that's been passed. So we don't have the same kind of issue with regard to the problem of the Sudafed. And who knows what's going to happen in the future, with these other states. Maybe that's why there's more meth coming into Georgia now than ever before, because now it's going out to these other states too, where it's harder to make the meth yourself. Again, if it's cheaper and easier to buy it from somebody from Mexico, then why would I risk being caught for manufacturing? I'll just go over there and buy it from this other guy, and then I'll just get caught for possession instead of manufacturing.
Thank you, Jim. Courtney, we've talked about limiting single ingredient pseudoephedrine to a certain brand and lowering monthly and daily purchase levels. What else do you think could be effective ways to at the local level to address this?
What we haven't talked about is prevention, really at all. And 90% of addictions begin in the teenage years. So that's why our Meth Project program targets 12 to 17-year-olds in particular. We know that if we can stop initiate use before the age of 25, that we're preventing addiction, which is critical. We should also say that the meth coming in from Mexico, the purity levels are so much higher from anything being manufactured in the U.S., which is really terrifying. And also what we're seeing is that the prices are so much lower.
Let me follow up on that. Senator Manchin, of course, talked a lot about the opiate problem. I guess there's some connection between use of meth and perhaps those persons going on to opiate or not. I'm not too well versed on that area of news.
Yeah, we haven't seen that in particular, but what we do know is that if someone is abusing more than one substance, they're poly users. It's probably 3 or 4, so that's possible that you're using meth and also prescription drugs, although I don't think we see a lot of that. I think which would be an interesting problem for prescription drug abuse if we could control which prescribers are allowed to prescribe pain pills, in particular oxycodone and Vicodin. If those who are specialized in pain management have a board certification in pain management could prescribe those. It's a simple risk mitigation strategy similar to other drugs that we've used. Now general practitioners are prescribing these medications. They're in the ER, dentists, and they're not specialized in prescribing these medications, and pain management specialists are. So that would be a solution.
Thank you. I have 2 other questions. One is fairly simple, so I'll ask that first. Len mentioned going across state lines for some chains to exceed the amounts one could buy. One state rule that hasn't got a lot of attention, as far as I know, is Arkansas's requirement that unless you're active duty military, you need a state ID, a state driver's license or other ID to buy pseudoephedrine products in the state. Is that something that that you think is perhaps a universal alternative that should be required or established?
You know, I think that's something great, because in Tennessee we had an astronomical number of Alaskan driver's license presented for Sudafed sales, and I'm not aware of any like direct tourism connection with that, or I guess it's just nobody knows what an Alaska driver's license looks like. So, you know, some guy's like, hey, the quickest way to do this would make you an Alaskan driver's license. So I think that's a very interesting idea to look at. Now, I have been on vacation and had a bad cold and ran into having to present my driver's license. So I can see consumers being a little reluctant to do that. But I do think that it is an effective tool that we need to look at, because I'm not for sure that the MPLEX system it works to legitimate driver's licenses when there's a purchase. I've not had that question directly answered to satisfy myself. So I do think that it's something that should be looked at.
Of course, I think Arkansas passed that law in 2012 or perhaps 2013, and that, you know, perhaps a perfect storm of issues brought the state lawmakers to do that. Lynn, what do you think of the chances that could happen in West Virginia, become a state law there, for instance?
You mean a state law for RX only, or?
In-state driver's license to purchase pseudoephedrine products.
Well, I don't think that in-state driver's license solved the problem. I think that it would be pretty much a legislative waste of time, because the biggest issue you have right now is the smurfing. And so the guy gets 5 of his friends in the truck, and they've all got West Virginia licenses. There you go. You've made the purchase. You know, in our stores, you know, we encourage our pharmacists to use professional judgment, and to a large extent, you know, prior to going to the tamper resistant, you came in with a Georgia license plate or a Tennessee license or Alaska, we were going to say, we're sorry you're feeling bad, but you're not going to buy that here. So there's some, I still think responsible social practices by businesses is the easiest way to address this problem. Because if you can go, I'd rather see a tamper-resistant only legislation in West Virginia. West Virginia has failed the last 2 or 3 times that the government was in session to pass a prescription-only Sudafed bill. And so I think that the next logical step would be to pass a tamper-resistant Sudafed bill, and then you don't have to worry about where the driver's licenses are coming from. And then that also addresses the stragglers who won't get on board, the Walmarts and the Krogers.
Thank you. The other question I had, and I'll make it as brief as possible. The Combat Meth Act allows DEA to determine that a formulation is actually tamper-proof, and then that formulation would no longer be required for behind-the-counter sales only. It could actually be over-the-counter, on-the-counter. And Acura recently had a licensing agreement with Bayer, who's now working, will or is working on that formulation. Do you think there's incentive for large pharmaceutical companies, Bayer, et cetera, to do that, to work on a formulation with Acura or other companies' technology that will get back to over-the-counter sales because it is actually tamper-proof?
I'll take that one. The technology exists, and you know, when I've gotten pressure from the producers of the non-tamper-resistant products, I tell them the same thing. Hey, you want to get your product back on my shelf? Spend a little money, make a tamper-resistant product, and we'll put it on our shelf. It all comes down to greed. That's the whole thing. These pharmaceutical companies have the technology to create a tamper-resistant. Nobody's going to say it's tamper-proof. The FDA will not say anything 100% that you can't extract 1% of meth from it. What we're talking about are tamper-resistant products that significantly, greatly reduce the ability to extract any kind of Sudafed from it, where it becomes not feasible for the meth makers. But if the consumer and the legislators and the public insists on having a tamper-resistant products, the companies who want to continue to sell that product will get in line and figure out a way to make it.
What about the incentive, though, if for a company that could have its single ingredient pseudoephedrine product actually on the counter, and should I need one, I could just walk in and buy it and pay the cashier and not have to wait at the pharmacy. And thankfully, it's not a problem I have. But do you think that the incentive to actually have a product over the counter rather than behind the counter will drive companies to really work on this?
I guess I'm the only retailer here, but yeah, I mean, it all goes back to market share and companies wanting to sell their product. And if that's what they have to do to be on the shelf and to be available for sale, then that's what they're going to do. But if all the other states continue to allow single ingredient Sudafed to be sold, whether it's behind the counter or on the shelf, there's no incentive for them to take a product that is a highly profitable product in its current state and invest the money to bring it to the next generation of being a tamper-resistant product. It's going to take the pressure of the public and the government to push that.
Go ahead, Jim.
Well, I'm just going to add a little something to what Lynn's saying, and that is that, you know, we're talking about so many different approaches to solving the meth problem and solving the drug abuse problem. The point is, they're all effective. They're all important. You know, if you do one and don't do another, then it's like the balloon that, you know, you squeeze it here and it pops out over here somewhere else. We've solved we think the lab problem in Georgia. Okay, well, we just got a huge amount of drugs coming in from Mexico instead to replace that. You know, and all the legislators in Georgia patted themselves on the back. Oh, we fixed that manufacturing problem. We made it so difficult, and so nobody's doing labs anymore. The law enforcement guys are all laughing at the legislators, saying, "Well, yeah, but it's all coming in from Mexico instead." And so you gotta approach the problem in lots of different ways. If we shut down all the stuff coming from Mexico, then this other problem is going to pop up again, and you're going to have to do tamper-resistant drugs. You're going to have all these approaches in place, and a huge part of that is education, public education, prevention education with these kids, especially these younger people. And it's not just meth, and it's not just opioids, it's every other drug that's going to come along over the next 15 years, 20 years, 30 years. There's a new drug du jour, every 10 years. Cocaine in the 80s or 70s and 80s, and then ecstasy, and then methamphetamine, and then the opioids. It just keeps, heroin now. It just keeps going. And so you got to start with this education program, telling kids, and you can educate them. I'm telling you, there are ways to do it where the kids get it. The Siebel Foundation, what Tom Siebel did was fantastic in 2005 and 6. He spent $30 million of his own money to try to figure out what kids would respond to. He hired sociologists, psychiatrists, drug addiction professionals, advertising professionals, Hollywood folks, got them all to the table and figured out what kids would respond to. They're not going to respond to, remember the old fried egg, this is your brain on drugs.
Hey, that was our ad.
Oh, sorry, well, okay. It worked for a while, but most kids kind of,
Watch it, Jim.
I know. The partnership did a great job of participating in the Siebel Foundation's work too, in the very early days of its creation. And people do remember those early ads. But with kids, you put a former addict on the stage talking to them who's 40 years old, they tune them out. You put a principal up there, you put a law enforcement person up there, they're not going to listen to them. They'll listen to their peers. And so we do a lot of peer education, peer-to-peer education, a lot of those kinds of programs. If you preach to them, they're not going to listen to you. Give them a bunch of statistics, they're not going to listen to you. If you give them some straight talk about this is the drug, this is its effects, this is effects on you, this is the effects on the body, this is the effect on your family, then they start to pay attention. Kids today don't want you to filter it for them. They want you to give it to them straight, give it to them raw, and they can tell when they're not getting it straight. Some people thought the meth ads were scare ads, scare tactics. That wasn't the intention at all. Glad that worked. But the point was to educate them. And you didn't have to make it scary. You could show them the reality of meth, and that was scary enough. That was dramatic enough. Show them the pictures of people before and after. Show them what's really happening with people with regard to, you know, all kinds of sexual abuse, child abuse, kids that are in foster care. Statistics go on and on and on in terms of the problems, but show them the reality, and they'll begin to get it. You know, they're smart enough that they can get that, and so that's a big part of the problem. But again, it's a holistic approach. You got to approach it from the law enforcement perspective, both at the federal level and the state level. You've got to approach it at the counters and with regard to what people are selling in stores. There's no one magic bullet that's going to solve this problem. I think that's the bottom line. You're going to have to approach it in a lot of different ways, in a lot of different areas.
Thank you, Jim. Sure. We have a few minutes left, and if you can, I'd like a chance to give your sense of you know, where we need to go next as a community, as a country on this problem.
Well, I think Jim hit the nail on the head. This is, there's no magic bullet with any drug abuse problem and how to solve it, and you have to approach it from all angles. The pharmacy companies need to be involved. The legislators need to be involved. The community members need to be involved. Teens need to be involved. Parents need to be involved. Community organizations need to exist. Schools need to approach this problem too and use our meth prevention lesson, hopefully, and know all the right answers. So, you know, I don't know that there's a way forward. I think what we've been doing has been working. I think tamper-resistant pseudoephedrine is critical in addressing this problem, as are other tamper-resistant medications, including the pain ones that are on the market.
Thank you. Lori? Where we need, as a community, as a country, we should go next on this?
Microphone's not there. It is. Well, I think education and prevention are two critical things that we need to remember. The more we can get into schools, the more we can have public service announcements that identify to kids. And social media is very much in the limelight right now. I have two children, they're 14 and 11, and they get tired of me talking to them about don't do drugs. But I monitor their pages and what they look at and what they watch on YouTube. You know, there's videos on YouTube where you can learn to make meth. Just go Google it. You can find out in less than 5 minutes how to make meth. So with all those things being thrown at kids, that dialogue really needs to occur on the front end, and the more funds we can put towards nonprofits that work towards educating kids in an effective way, along with educating communities. When we started our talks, our local pharmacies were not aware about Sudafed, and so I think we need to get the word out there to make sure that even in rural America they know that this exists and it's a very viable solution for them to help fight meth.
Lynn, would you care to take our last minute or so?
I think everybody said it all.
Thank you very much. Thank you everybody for your wonderful comments and very insightful comments today, and thank you all for being here, and hopefully we provided some great information to share with you in your offices and as a way forward on this problem. Thank you.